Overdose deaths have spiked during the pandemic, and the Pinellas County Opioid Task Force says that more than one person dies in the county every 26 hours from an opioid-related overdose.
There was a point down here where I was overdosing. It was quite a bit. I don't want to put a number on it, but let's just, it was a lot. Very, very, very lucky. It's a miracle that I'm sitting here today.
That's Brett Mahaffey. He lives and works as the house manager at the sober living house. He's currently in recovery, and just a few weeks ago, he celebrated 6 months of sobriety. But the journey to recovery hasn't been an easy one.
I got a DUI shortly after high school, which it didn't stop anything. If anything, it got worse. The drinking was still there as well. But the opiates slowly started overcoming everything else in my life to where it started affecting jobs. It started affecting relationships with family. And it really started affecting the way I felt as a person.
Compared to the national average, 2018 research had shown Florida providers were more likely to write opioid prescriptions, and men in Florida were more than twice as likely to die of an OD than women. COVID-19, though, made things more complicated.
When you're looking at overdoses, those are people that are not coming back. So when the pandemic first started, our experience was we had people plan to come to treatment. Some people left, they went back home. There was so much uncertainty and unknown. So people left treatment early, and then people that were planned to come didn't come.
John Templeton Jr. is the president of Footprints. It's the same organization that owns the sober living house where Brett lives. In a report from the Florida Department of Health, overdose deaths were up nearly 50% since the same time in 2019. There were more than 3,600 deaths from March to August 2020, and that's about 19 people overdosing and dying in Florida every single day.
All those positive outlets, the gym, their social circle, they were completely cut off. So people are now isolated, afraid if they'll ever have a job. And, and some people that's, for an alcoholic or addict, any day you don't use is a miracle. And so when you add that stuff on, I don't condone it, but I can understand how that would lead people to, pick up that drug of choice again.
Brett works with other people going through recovery. He saw the effects of the pandemic on the guys he lives with.
I can't put an exact number on it, but I'd say we had 2 or 3 guys here, they relapsed. And, it would start with they lost their job, which they lose their job and then they'd be sitting around. And when they're sitting around with idle hands, and it's kind of just a matter of time.
Brett knows what these guys are going through. He's been through a lot in his life, and some life events have caused him to relapse.
I got a phone call from my youngest brother, and our parents had got killed. Our mom and stepdad had got killed on a motorcycle. Alcohol was involved, in both parties, I should say. Alcohol was involved. And within 10 or 15 minutes, I had relapsed. I wasn't in a spot in my life or even with my sobriety to where I was able to deal with those kind of things without using drugs or alcohol. At this point, the alcohol there was no alcohol. It was strictly opiates. It was Percocets again for a bit, then it was strictly heroin, and then it was strictly fentanyl. I'd say 95% of the time I wouldn't know it was fentanyl.
Florida's 2019 annual drug report shows the drugs that caused the most deaths were fentanyl, cocaine, and benzodiazepines. Deaths caused by fentanyl in 2019 increased by 38% compared to 2018. Now, treatment centers are seeing these powerful substances used more frequently.
We've seen an increase where clients are testing positive for fentanyl as well. And they didn't report in their admission criteria that they had ever used fentanyl. So what we're seeing is people that think they're just abusing even like a Xanax, which is a different classification, are, getting fentanyl the way these drugs are cut and made and synthesized. So it's really dangerous.
EMS services also saw a spike in opioid calls. Between October 2019 and September 2020, Pinellas County EMS and Fire made more than 6,500 transports in suspected overdose cases. That's about 1,500 more than the previous fiscal year. And they're transporting people at an alarming rate this year. Seeing more overdoses every day has people like Brett worried for the younger generation.
I'm 32 years old now, but if I would have, really got honest with myself and others and decided to, go this way in life when I was younger, I would have saved myself a lot of problems, and been able to, really make a lot of great memories with family and friends, meaningful things. But instead, drugs and alcohol, came in the way of those.
Complete data from 2020 and 2021 is still unclear, but we could be waiting a few years as the latest data from the CDC is from 2018 and 2019, but preliminary numbers don't look too good. If you or a loved one you know is struggling with a substance use disorder, we'll have a link to resources in the web article with this story.